So I want to touch up a little bit about shape and size of breasts. I would say rarely do I ever get anyone that come in the office and say, I want something that looks unnatural. Almost everyone say they want to look natural, something that's proportioned to their body. So I'll say, what size do you want to be? And sometimes I even get patients say, well, it's up to you, Dr. Nikko. Whatever you think is proportioned to my body. Unfortunately, that doesn't work so well because everyone has a little bit of a different opinion about what's proportionate to their body, right? And then I would say 90% of patients that come in and see me want a full C or a small D. The problem is there is no right answer when it comes to what's a full C, what's a small D. I mean, I can show 4 set of breasts and I'll ask 10 different patients to kind of like give me their thoughts, and I can tell you I'll get anywhere from 4 different sizes to 5 different sizes. So what matters is really for what each individual person think is a full C or a small D. There's no wrong or right. So what about, they may say, well, bra size. Well, it depends on where you buy your bra. So each bra manufacturer, each bra store has their own different measuring and different measurements. And so it's very hard to go by bra size. So what I like to do is show patients a lot of different photos. And by using photos, like I'll flash a photo of what I think is most of patients would like, and they would kind of go from there and say, oh, I like that. Or they may say, well, I like that, but I like a little bit more fullness in the middle. Or I like it, but maybe a little smaller. Or I like it, but maybe a little bit bigger in proportion to their body. And then some people may look at that photo and say, well, I can't tell because she's not the same size as I am. I'm like, I understand. But in proportion to her body, what do you think about her breasts? So if you say, yeah, I like it, then I can sort of match for that particular patient. For example, if she was a little smaller, then obviously her absolute breast volume will be a little smaller. If she's a little bit bigger build, then of course her breast is going to be bigger than the one in the picture. It's all in proportion to that patient's body. And so I never really go by, okay, I want it to look natural, because I can tell you 90% of patients who nowadays who want natural breasts, they want this fullness in the middle. And fullness in the middle is not really natural breast. Natural breast has no fullness in the middle. So natural doesn't mean anything to me. It just, I need to understand it by looking at photos. And that's the best way to communicate. It's just by photographs, and then we have dozens and dozens, and then patients find their own photos. And so by the end of the day, we're gonna find one that patients really like. And I use that. I put it up in the OR, and then as I'm doing surgery, I try to get it as close as I can. I don't guarantee that I'm gonna get it exactly like that, but I get pretty close. And that's how I do it.